In my previous bipolar disorder video, we talked about 1, 2, and 3. Today, we're going to talk about 4 through 7. So the fourth type of bipolar disorder is known as substance/medication-induced bipolar and related disorder. So this diagnosis requires evidence from a patient's history, physical exam, and/or lab findings that the mood disturbance developed during or soon after either substance intoxication or withdrawal or after exposure to a medication. So examples might include alcohol, cocaine, dexamethasone. There's a long list, but it doesn't include the appearance of any hypomanic or manic symptoms that may occur after someone with an identified bipolar disorder starts taking an antidepressant. The fifth type of bipolar disorder is called bipolar and related disorder due to another medical condition. Now, this diagnosis requires evidence from, again, history, physical exam, and/or lab findings that the mood disturbance is the direct consequence of another medical condition. This means the person did not have bipolar disorder before they developed the particular medical condition. The bipolar disorder onset in this case is usually within the first few weeks or month after the onset of the other medical condition, but this isn't always the case. Some examples of medical conditions that may be associated with bipolar disorder include things like Cushing's disease, multiple sclerosis, stroke, and traumatic brain injury. The disorder may appear before or just after the medical condition does. The sixth type of bipolar is called other specified bipolar and related disorder. This applies to a person with symptoms of bipolar that cause some impairment but don't meet the full criteria for any of the bipolar disorders. Examples could be like short duration episodes of mania or depression, hypomania without major depression, or cyclothymia that lasts less than the 2-year requirement for an adult. The reason for the lack of a full diagnosis of bipolar must be stated. For example, other specified bipolar and related disorder, short duration cyclothymia. The seventh type of bipolar disorder is called unspecified bipolar and related disorder. So this diagnosis applies to a person with symptoms of bipolar that cause impairment again, but don't meet those full criteria for any of the bipolar disorders. In this case, though, the reason for the lack of a full diagnosis of bipolar need not be stated. So this is for those times when there's insufficient information to make a more specific diagnosis, such as when a provider maybe sees a patient in an emergency room or during a mental health crisis visit. So those are the 7 types of bipolar disorder, 1 through 3 in the first video, 4 through 7 here. Some of you may have heard of other types, but those are most likely specifiers that may be added to a bipolar diagnosis rather than an independent diagnosis of another type of bipolar disorder. Examples include specifiers for rapid cycling or psychotic features. So in the next video, we'll talk about some of the specifiers that can be added to bipolar disorders, including a specifier that might actually capture some people who are also incorrectly diagnosed with borderline personality disorder. Stay tuned.